Hey, future counselor, welcome to 10 concepts you must know in order to pass your addiction exam. If you learn these 10 concepts, you'll be able to pass any addiction exam. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment professional. I think I know a little something about how to study and pass an addiction exam, and I'm going to teach you everything I know so you can pass too. All right, let's talk about what you'll learn when you finish this entire video. You'll understand the key concepts that you must learn in order to pass your exam. You'll also get 5 topics under each general concept that you can study. And also you'll get a practice question. So for each concept, I'll give a question example of what you might see on your addiction exam. The first concept you must know and understand is the treatment admission process. What actually happens when the client first enters care? This is the beginning of everything. The paperwork, the gathering information, building trust, and determining the client's level of care. Key topics that fall under the treatment admission process include screening, intake, orientation, eligibility, and building rapport. If you want a deeper dive on any of these topics, comment which topic you're interested in, and I'll do a more detailed video on that topic by itself. Let's look at a question that might fall under the treatment admission process concept. During the admission process, which of the following occurs before the client is officially admitted to treatment? Orientation to program policies, completion of informed consent forms, screening for program eligibility, or development of a treatment plan. Which of these happens before the client is admitted? The correct answer is C, screening for program eligibility. Remember, screening always happens before the official admission because it's how we determine whether the client should enter care with us or be referred somewhere else. The second concept you must know to pass your addiction counseling exam is clinical assessment. You must know how to gather, understand, and organize client information. This is where you go deeper than the intake. The assessment is where you ask all the questions to either diagnose the client or get a clear picture of what they will be working on in counseling. Key topics that fall under the clinical assessment concept include substance use history, co-occurring issues, the actual tools that you use to assess the client, how ready they are for change, and diagnostic impressions, meaning how you're going to diagnose the client. Other topics include health history and family support, or even barriers to treatment. Let's take a look at the type of question you might get under the clinical assessment concept. A client reports drinking 3 to 4 beers daily, using marijuana on the weekends, and feeling anxious all of the time. The counselor notices the client appears restless and has mild tremors. What should the counselor do next to guide the clinical assessment? A, provide a diagnosis of alcohol use disorder and begin treatment planning. B, administer screening tools such as the audit and DAS to evaluate use patterns and severity. C, educate the client on the stages of change model and encourage abstinence. Or D, explore family history of substance use before determining readiness for change. The correct answer is B, administer screening tools such as the audit and DAS to evaluate use patterns and severity. This question tests your ability to prioritize the steps in the assessment process. It helps you to slow down and gather data before moving into the treatment planning or diagnosis. That's the critical thinking skill that you'll need to pass your addiction exam. The third concept you need to know and understand to pass your addiction exam is treatment planning. This is where you help the client develop goals and change as needed. This is where all the information you gathered during the assessment process comes together. The plan acts as your client's and your roadmap towards success. 5 key topics that fall under the treatment planning concept include SMART goals, client involvement, making updates to the treatment plan, cultural relevance of the treatment plan, and discharge planning. Let's walk through an exam question that you might get that falls under the treatment planning concept. A counselor and client are reviewing the client's treatment plan during a monthly check-in. The client reports meeting one goal, struggling with another, and wanting to focus more on employment readiness. What is the counselor's best next step? Leave the plan as is since progress was made on one goal. Create a new treatment plan from scratch. update the treatment plan to reflect progress, challenges, and new priorities, or end services and move towards discharge since one goal was completed. The best answer is C. Update the treatment plan to reflect progress, challenges, and new priorities. This shows you understand that the treatment planning is a living, changing document. It changes as the client changes and as the client makes progress, or even sometimes as they regress. The plan should always reflect the client's current goals, level of motivation, and progress towards recovery. The fourth concept you need to know to pass your addiction exam is counseling skills. This concept is all about the how of counseling, how you interact with the clients, how you communicate, how you connect. Key topics that fall under the counseling skills concept include core skills, motivational interviewing, CBT techniques, crisis intervention, and family and group work. Let's review a type of question you may get that falls under the counseling skills concept. During a session, a client says, "I don't think I have a problem. I can stop using anytime I want." The counselor replies, "It sounds like you're confident you can handle things on your own." Which counseling skill is the counselor using? Giving advice, reflective listening, confrontation, or interpretation? The correct answer is B, reflective listening. Instead of arguing, challenging, or giving advice, the counselor reflects the client's own words in a calm, neutral way. This shows empathy and helps the client feel heard without judgment. It's one of the core skills in counseling, specifically motivational interviewing, and this is what they'll be testing you on your addiction exam. The fifth concept you must know to pass your addiction exam is case management, how you connect the client to resources. This is all about connecting them to the support they need in order to maintain success in recovery. Key topics that fall under the case management concept include referrals, collaboration, advocacy, follow-up, and boundaries. Let's look at the type of question you may get that falls under the case management concept. A client in outpatient treatment reports missing several sessions because they lost access to transportation and is about to be evicted. They say, "I want to stay in treatment, but everything else is falling apart." What is the counselor's best next step? Explore the client's feelings about relapse risk and continue therapy as planned. Refer the client to a higher level of care for substance use treatment. Assist the client with referrals to housing and transportation resources to remove barriers to participation, or confront the client about personal responsibility and commitment to treatment. The correct answer is C. Assist the client with referrals to housing and transportation resources. Here's why. The question is about case management. Focusing on connecting the client to services and supports would be the best answer. Not that any of the answers are completely wrong, but the best choice would be case management. In this situation, the problem isn't motivation or relapse. The problem is the barrier to continuing treatment. The sixth concept you need to know to pass your exam is documentation, how to keep accurate records of client care. Key topics that fall under the documentation concept include progress notes, treatment plan updates, confidentiality laws, late entries, and professional tone when documenting. Let's look at the type of question you may encounter on your exam that falls under the documentation concept. A counselor completes a progress note after a client session and realizes the note was written 2 days late. The counselor clearly labels it as late entry, includes the actual session date, and signs it. What does this action best demonstrate? A violation of confidentiality due to the delayed entry, proper documentation practices that ensure accuracy and transparency, poor time management and non-compliance with agency policy, or a breach of ethical standards under the HIPAA and 42 CFR Part 2. The correct answer is B, proper documentation practices that ensures accuracy and transparency. Even though the note was completed late, the counselor handled it correctly by labeling it late entry and included the right session date. That shows honesty and accountability, two key parts of accurate professional documentation. The seventh concept you must know to pass your addiction exam is discharge and continuing care. You must understand how to plan the appropriate supports for after treatment for the client. Key topics under the discharge and continuing care concept include relapse prevention, aftercare, follow-up contacts, client encouragement, and documentation of discharge. Let's look at an exam question that may fall under the discharge and continuing care concept. A client successfully completes a 90-day residential treatment program. During discharge planning, the counselor helps the client identify triggers, connects them with a local support group, and schedules a follow-up for the next month. Which of the following best describes what the counselor is doing? Providing emotional counseling to process past trauma, developing a relapse prevention and aftercare plan, assessing readiness for inpatient admission, or ending the therapeutic relationship permanently. The correct answer is B, developing a relapse prevention and aftercare plan. This question is checking your understanding of what happens during discharge. The counselor is preparing the client for life after treatment. The eighth concept you must know in order to pass your addiction counseling exam is legal and ethical issues, the rules and laws that protect both the client and the counselor. 5 key topics that fall under the legal and ethical issues concept include confidentiality, informed consent, boundaries, mandated reporting, and competence. Let's look at an exam question that may fall under the legal and ethical concept. A counselor receives a court subpoena for a client's records but no client release. What should they do first? A, send the full file. B, contact the client to discuss consent. Or C, ignore the subpoena. D, write a summary and mail it to the judge. The correct answer is B, contact the client about consent. Under 42 CFR Part 2, you need written client consent before disclosing any information about their care, even with a subpoena. Remember, 42 CFR Part 2 is a federal law that protects people who are receiving substance use treatment so that they are not judged, they are not unfairly treated, and so that their health information is protected. It's a little more strict than HIPAA laws. The ninth concept you must understand to pass your addiction counseling exam is professional growth. You must understand and learn about how you reflect on your professional and personal growth as a counselor. Key topics that fall under the professional growth concept include supervision, continuing education, burnout prevention, ethical self-awareness, and team collaboration. Let's look at a question that may fall under this professional growth concept. A counselor feels emotionally drained and less patient with clients. What is the most appropriate next step? Take a week off without notice? Discuss the issue in supervision? Keep working until symptoms pass? Or ignore the feelings and focus on clients? The correct answer is B, discuss the issue in supervision. Supervision helps address burnout, maintain ethics, and ensure client safety. It's a vital part of your professional growth as a counselor. On your addiction exam, you may be asked questions about how you take care of yourself as a licensed or certified professional. It's important. It keeps you safe, and it also keeps the client safe as well. The 10th concept you must know to pass your addiction exam is physiology and psychopharmacology. We need to understand how drugs affect the brain and the body. As addiction counselors, we don't prescribe medication, but we must understand how substances affect our mind and body in order to educate and treat our clients. Key topics that fall under the physiology and psychopharmacology concept include drug categories and drug schedules, the brain reward pathway, tolerance and withdrawal, medication-assisted treatment, physical warning signs, and how drugs impact our nervous system. Let's take a look at an exam question that you might see that falls under the physiology and psychopharmacology concept. A client taking methadone for opioid use reports drowsiness. What should the counselor do? Tell the client to stop taking it, encourage the client to speak with the prescribing provider, adjust the dose themselves, or ignore it. Drowsiness is normal. The correct answer is B. Encourage the client to speak with the prescribing provider. Counselors do not change medication, they coordinate care and refer to medical staff. We've reviewed all 10 topics you must know in order to pass your addiction counseling exam. Make sure you subscribe to the channel so you are up to date on all of our study guides. If there's a topic that you would like me to cover, make sure you put it down in the comments below. Also, there's a free study guide for you that you can download in the description. Go ahead, download it. I will see you soon. Thank you so much for watching.